My name is Paulo Bus. I'm a professor of National Health, Public Health, School of Foundation of Fiocruz. I'm director of International Center for Health. Today, we're going to speak about global governance and health. It's not about the governance of global health. It's not a game of words. This has already been discussed in Module 3. We're going to speak about global governance and health. That means the elements of governance that are out of the health field but influence health. In the presentation of Module 2, you discussed what is written here. The number of external factors that influence the population's health and the health national systems. That has been discussed, and the great current issues by Professor Mauricio, and the debate was how the global determinants and social determinants of health, including the global ones, have influence in the health of population. Nowadays, we're going to discuss the global governance. That means the extra-sectorial governance and how it influences the health of people, and it influences the protection social system and the health systems of the countries in Latin America and the Caribbean. The concept of global governance is this one that is here on the slide: the set of institutions, mechanisms, relations, and complex processes, formal or informal, among states, markets, citizens, and organizations of the government or non-governmental, by which, in a global level, many interests will be articulated, laws and guidelines are established, and differences are mediated. That is, it's a concept regarding the diplomacy of health. The word governance, that is understood here, of Taco and Wise, developed in 2006. This word governance includes more than governments and civil society, and it understands not a government but a nation, a greater set of people greater than the government. A lot of people with this contemporary situation act on health and act on international cooperation in health. The system of the United Nations, including their agencies, programs, and funds that are different things. For example, the OMS and PAHO have been presented by Professor Tobar in Module 3. UNDP, UNICEF, and the OMC, CEPAL, Economic Commission for Latin America and Caribbean. That is one of the 5 commissions, regionally speaking, for the system of the United Nations. The fostering bank, like the BIRD and the IDB, that compose the system of the United Nations, are very important players that have an important role, globally speaking. The government is sub-regional ones. For example, UNASUR, SICA, the Central America, CARICOM, because here I'm referring myself to the sub-regional ones of the Americas region, for which we're having this current process of preparation for people to international area. The cooperation national agencies of the developed countries, for example, USAID, JICA from Japan, IRD from France, a number of agencies that act in the international field, in the international cooperation. Philanthropic foundations that are private, that Professor Tovar also mentioned, the importance that they acquire, as, for example, the Gates Foundation, that is the greatest of the private foundations acting on health, the Rockefeller Foundation, other foundations that are also very important. And also it's also very important to mention the performance and importance as a global player that acts on health, the private companies that are are transactional, being of drugs or private companies of other sectors. For example, the ones that act as a consequence on the environment. For example, oil companies that also act derived from their performance and their impact on the environment, they act on the human health. And finally, the civil society, internationally speaking, the NGOs and other ways of representation that are also global players in this world that is so complex and this complex governance. Therefore, the class that I'm going to give today is an introduction. It doesn't intend to end this subject that is complex, and there are a great number of books that we recommend you to read. To start, we will speak about the system of the United Nations, and especially we have included this complex figure here because the United Nations is very complex. Since its very beginning, 1945, as a solution found by the winning alliance from the Second World War, several political agreements have been signed. And then we have the United Nations that since then, 70 years ago, has tried to find the way to maintain the peace. And we all know that they haven't been successful in this because there's so many armed conflicts, so many aggression conflicts to human rights that we have in the whole world. Therefore, maintenance of peace, that is the main vision or mission, of the United Nations. In fact, we can even question that they have problems in their central mission, and the United Nations have 5 main bodies: the National Assembly, the General Assembly, that has 194 countries that are members of this assembly, the Security Council that is formed by the main countries that won the Second World War, and that we work basically on the subject of intervention or non-intervention on conflicts. And afterwards, we have this central core nucleus formed by the United States, Russia, France, England, and China, a set of members that are different ones. And this is a problem in the United Nations exactly because there are many other countries that are emerging ones that want to be part of this main body of the United Nations after the General Assembly, that is the Security Council. We have the Legal Court, we have the ECOSOC. It's an important economic and social council where they debate and discuss all the social relevant issues, and a set of programs, funds, and agencies that are experts. The fund programs that depend on the United Nations or the Secretariat, that is the 5th body that I had forgotten to mention, and also the specialized agencies that are autonomous but do not depend on the programs and funds of the Assembly or the Secretariat. This action of the United Nations in the countries, and also globally speaking, they have roles that develop themselves many times not in an organized way and in conflicting ways sometimes. That's why we have inside the United Nations, at the request of the countries, this is a concept that I want to mention specifically to you because it will represent in each of our countries is the concept of one United Nations. One United Nation is a delivering together, is an effort that was performed by the countries at the request of the Secretariat of the United Nations for them to organize themselves, for the agencies to operate in the countries in a coordinated way, in a very clear way, in order not to have any conflicts under their missions. And through this coherence of action and this connection and coordination, the effects of the United Nations, mainly in the small countries, that this could result in a more effective results. It has to be a coherent United Nations consolidates activities according to the development plan of each country. It's a government of funding that has to be adequate to the actions of each country and linking the fundings to these agencies according to the development that they will reach. Review ways of performance, have focus in results, capability of responses to local requirements, and to act as one UN. The new opportunities of consolidation, effectiveness of this new unicity, and this has already occurred, and we have created one UN because the challenge of implementing the objectives of the millennium in 2005 in the first quarter of the period demanded this change in the work of the UN. And now for the objectives of the plan for 2030, more than ever, a single UN is necessary. That means, in general, the action in the countries is coordinated by the UNDP, the representative UNDP, connected MS, UNICEF, and so on, and making a coordination of all this work. After the period of the end of the Cold War, that the UN tried to be an intermediary of this political silent conflict, sometimes noisy one. The United Nations, after the Cold War, starts to prepare itself with a set of conferences that are listed here. I'm not going to speak about each of them, obviously, that occur in the 90s to create an agenda that should be global for development, or the global agenda of the United Nations for development. It is implemented by several agencies with the participation of the different member states. And with this, we build a political structure that is the summit of the millennium that occurs in the 20,000 and the agenda of development for 2015. This same agenda for development ends this year of 2015. Exactly in September, it ends. However, in 2012, we started to prepare what will be the agenda for development 2030, or after 2015, now called the development for 2030. This occurs when we install and develop in Rio de Janeiro the Rio Plus 20 conference. That means the conference that comes after 1992, that was the conference of the United Nations for the development in Rio de Janeiro. Rio Plus 20 generates a document called The Future That We Want, a document that was signed by all the members of state and defined this set of actions that should take part from 2012 to 2015. It is a complex one. We have, again, a complex structure, but basically this includes sectorial consults. For example, in health, we perform consultations on how health should be considered in the development agenda, and the civil society was included, and also the agencies of the United Nations were concerned in working together to find their vision on the agenda after 2015 or 2030, and the main, let's say, moments and the main documents of this development agenda that are related here. First, the Millennium Agenda and the objectives for the development of millennium, because it was based on the experience of the agenda of the millennium and the objectives that we start building the agenda post-2015 or the agenda 2030. The future document that we wish, we had the Rio Plus 20 in 2012, and this broad process of consultation that I mentioned in this diagram, and that the health sector has specific consultation on how health should be considered in the development agenda in Botswana in 2013, less than 1 year after the Rio +20, and we structure a group called Open Working Group that is a group of 30 places. But these places vary, the country varies according to the subject. 194 countries resulted from the outcome document from the Open Working Group, and finally, by the decision of the Assembly of the United Nations, an intergovernmental group launches and defines a document called Transforming Our World, Agenda for Development 2030, or Transforming Our World, the Development Agenda 2030. This document is examined by the United Nations Assembly in 2015. What does it include? It includes 17 objectives for sustainable development, being 2 of them, the 16 and 17 objectives, let's say, of how to do, and the other objectives are from 1 to 15 are objectives called ending ones. These are objectives that are connected to economic sectors, social sectors, and environmental sectors. They open the ODSs with the social sectors, so the end of poverty, the end of famine, the security of food, better sustainable agriculture. These are the main objectives of the 2 first ODS. To ensure a healthy life and promote the well-being for everyone at all the ages is the objective of health. It's very powerful. Let's see. You can see, ensure that in diplomatic language, it's not very little to ensure a healthy life. And not satisfied with this, and to promote the well-being for all in all the ages. So this is a wording that is very important, and this we can see that unfortunately when we translate the objective into a target and indicators, that's the scheme, we will see the difficulties that we will find when we have to word the targets to reach objectives. Education is objective 4. Gender equality is 5, water and sanitation 6, energy, very important subject, polluting or not necessary, energy is very necessary, objective 7. The number 8 is economical sustainable growth and with sustainability. Full employment and decent work. This is economical objective. It's difficult to understand why the word sustainable work. Do we forever need sustainable growth? Can we think in a decrease with maintenance of life quality? That means distributing better the growth in the world. And then we have immediately the objective 10, to reduce inequality within and among the countries. This objective is related with objective 8. Objective 9 regards industrialization and fostering of innovation, and objective 11, cities and human settlements that has to be sustainable. Number 12, ensure modalities of sustainable consumption. This is very important. When we link 12 to 8, it's difficult to conciliate both of them. So we have, let's say, several objectives that if we do not deal with them, the system of the United Nations doesn't have surveillance, we will have conflicts among these objectives, and this is the central idea of the Agenda for Development. Objective 13, also commented very deeply in the world and approached in our Module 2 by Professor Mauricio, is climate change and its effects on human beings. And we also would mention now will be the objectives, as I mentioned. We have the social, the economic, and now we will talk about the ones that could be called environmental ones, means oceans, seas, maritime resources, 14 and 15, ecosystems, forests, desertification, so on, and 16 and 17 are Pacific societies and inclusive ones, facilitate the access to justice for all. And now we have an important thing about governance, the creation of institutions that have to be efficient, effective, and inclusive, and responsible. That means the good governance. The governance issue is in this 16, Objective 16. That's why I call this one of implementation. And the number 17, obviously, is an objective that is to strengthen the execution means and to revitalize the sustainable movement. We will see that this issue of alliance for sustainable development can be questioned since ever, because the commitment from the year 2000 would be that people would put 0.07 of their GDP as a donation. And in fact, only 5 countries were able to do this. But this is a chat for later on. When we examine the set of objectives, what we can see is that all the so-called ODS that are not related to health, poverty, education, and so on, gender, they are able to impact positively or negatively in health. Depends on how they will be implemented.
It's very important to discuss all these sustainable development objectives because related amongst them. And the ministries of health, also the different international affairs offices, possibly will be responsible together with the ministry so that they can, in each one of our countries, they can crystallize the agendas that our heads of states and presidents signed in New York in September of 2015. And now it's high time. 2015, September is over. The general agreement is over. It was signed, yes. Now we have to translate inside our countries to incorporate in the development agenda of our countries the commitment that we signed. But this is a conversation for later. What I wanted to highlight objective number 3, with guarantee healthy life and promoting well-being for everybody. So this objective actually is divided in 8 goals. The 3 first goals are the same ones that were in the Millennium Development Goals. Mortality in mother and child mortality, and also there are small changes, or even with some numbers, or let's say a few rates that the world would actually engage to reduce as a whole. And malaria, TB, and HIV, that were goals of specific diseases, now are extended, including other diseases, including hepatitis and other communicable diseases. We can say that, generally speaking, this is the agenda has not been achieved in terms of MDGs. So they stay in the Sustainable Development Goals. We have, this was presenting also Model 2, we have the issue of non-communicable chronic diseases. Non-communicable diseases and the issue of mental health are in goal number 4. In goal number 4. In goal number 5, also, let's say, it's a new issue, our re-emergence, better said, or even reinforcement of the situation, pre-existing situation, which is abuse of addictive substances, including drugs, and also and alcohol. Alcohol, actually, excessive consumption of alcohol. This derives from the negotiations with the alcohol-producing companies in the world in goal number 6, also given by modernity, because it's an enormous increase of deaths due to traffic accidents, also are included as a target to reduce by half traffic accidents in motorcycles. All of us who work with health are cognizant of this important situation. Then we go into sexual and reproductive health service, universal access, and then we go into item number 8, which is important, which is universal coverage. And it's a very conflictive issue, because universal coverage, it can appear as universal coverage, avoiding catastrophic expenditures as formulated, and access to quality service and safe medication, accessible, so forth, but that we have criticized widely in our analysis, since we do understand the universal coverage, better said, yes, will only be achieved through universal systems that are equitable and good quality. Universal systems that are equitable, integrated, and good quality, based on the right to health and not based on the health insurance or the purchase of a health insurance policy by a family or individual. This is a difficult concept. We have two concepts here. There are two different approaches for the same issue. Then, for last objective 3.9, which is death related to chemical water contamination or pollution that is related to farming and the contamination or pollution in cities. We have two objectives that are dedicated to specific implementation in terms of health, which are the framework agreement for tobacco, the whole issue of the innovation, research and innovation for vaccine medications, and the issue of financing of health and human resources, and finally, which would be epidemiological surveillance. When examining this set of goals, we wonder if this set of fragmented goals could ensure achieving the ambitious objective of health and well-being for all in every single age bracket. This is something that, from my research, my personal perspective as researcher, no, but we have to discuss, because this is very important. So we have to see how are we going to be translating this in our agendas of our countries. Ensuring healthy life and well-being is the issue, or providing universal coverage. Universal coverage, or are there universal systems? What do we understand as care? Actually providing care to the diseased, or integrated care, the right to health or insurance, absence of public health, and environmental health. This is another topic that when we observe the goals, we can see that this issue of the public health technologies, the surveillance in public health, the issue of environmental health, do not appear in the set of the objective goal within the framework of goals. Medication and vaccines, which are essential or necessary, because the concept of medication and vaccine is a minimum package. It's always been like this, but we would rather have the denomination of medication and vaccines that are necessary according to the epidemiology of each one of the countries, and not mention to medical technologies, as we were going to be resolving everything with just medication application of vaccine? Where is diagnosis? And where are the technologies left? Actually, they're too expensive for the poor. This is a situation. These are issues on the health that are in the agenda, and we have major and clear concerns on bringing to the debate this type of issue. Why do we bring our concerns to the table? Because we understand in terms of goals of the health goals, also the issue of development, health and development actually is not mentioned. Social determinants in health are poorly stated. We fragmented health in several issues. Not even social development factors appear. Even less determination in health. This is why we would have an additional proposal with the proposal 3.10, which is actually to approach these determinants through new governance methods that would include the other government sectors and the civil society, and at intersectorial level. This additional proposal, I insist once again, is not going to be able to be omitted. Actual international global framework signed in New York in September of 2015. This is over. Now the thing is now, how can we translate this agenda and these sustainable goals into our national agenda? We, in our group, or international relations offices, we should ask ourselves who is going to be coordinating this process of these sustainable development goals in our countries. Which agencies or United Nations bodies are going to be coordinating the implementation of the agenda in our countries? The third thing is how the participation of ministries of health will be actually equated, which is the correlation of forces in the Ministry of Health with other ministries in implementing the agenda as a whole. We health, we can dialogue actually with the other sectors, and also we as health should be held responsible not by the agenda or for the goals, also or the extension of goals that I mentioned actually previously in the slides. Who is going to be representing the Ministry of Health? How this representation will articulate internally the different levels of the ministry in order to be working in the implementation of the goal health and the other objectives in their connection with the field of health. What is the role to be played by the international relations offices, which are part of the ministry? The health objective is proposed with these goals. Is it adequate for our country? We wonder. The goals they're sufficient for our country in terms of sustainable development, are well formulated. Should we reformulate these goals? Is this possible? Because all the kinds of autonomy for such purpose, maintaining actually the global perspective. The Americas have been working on this strategy for health in every single policy. Also, this is a resolution for 2014 for the General Assembly from the board of PAHO. Actually, can it be used in order to reach the health objective and mobilize the other objectives in terms of implementing this agenda? I'm not going to read out the whole implementation. I would just want to challenge you, because we, in our offices, we have to learn about these resolutions. We have to understand how they do connect to health and also these development goals. And finally, which connections our ministry should have in the National Congress with the civil society. These are issues of the essence in order to translate the agenda. What we understand that would be the most important political global movement that's going to be impacting on health. I will conclude talking about the international cooperation model. All of this is political cooperation, is the field of politics, and it's also very important that each one of our countries should cooperate politically with the other countries in order to have this full implementation of the health agenda. But it's not just talking about political but technical cooperation. It's the whole issue of the ensemble of donors that we use to work with. I give an example of health in the United Nations agencies: UNICEF, UNAIDS, UNITAIDS, UNDP, UNESCO, ILO, FAO, UNEP, Fund of the United Nations for Population, the ECLAC, the Fermentation Banks, the WHO, WIPO, for example, and others too, that are agencies of the United Nations. All of them do have actually a program or something related to health. The document that you are getting together with us class contains an analysis of each one of these agencies, the health in these agencies. On the same foot, we made an analysis of health in the agencies of the developed countries that support developing countries. For example, the countries of Latin America and the Caribbean, USAID of the United States, European Union, Canada with CEDA, IDRC, the German Cooperation Agency, JICA from Japan, and also we tried to showcase in our paper health in Rockefeller Foundation, in Gates Foundation, in Ford Foundation, Wellcome Trust, Clint Foundation, and others are the most important ones, be it cooperation agencies belonging to countries or be it different foundations. And these United Nations agencies and also these actually other foundations, they used to define, doesn't mean that it's always this way, centrally their very own cooperation program, many times with very little or nothing to do with the policies that are being developed or that are included in the health programs pertaining to the theoretically receiving countries. We rather to have the concept of cooperation, which is called a partnership. We want to be partners in this cooperation effort because always there is no country that support that cannot donate anything or countries that are so rich that don't need anything. This is a Boaventura Santos concept. The whole idea that lies behind all of this is these partners, they do need to be connected, and it is necessary also to identify the different donors aligned to health policies that we in our International Relations Office design, knowing the health policy of our countries as we design, they should be working together with these countries or with these agencies or with United Nations or with the private foundations that offer and provide to our countries for the health in our countries. A certain time of aid or support. This has been aligned definitely. All of this has been tested to be aligned with the health policy in the country. On the other hand, the amount of donors and their definitions made at governmental level exist, and ODIS, also with the International Relations Office, should do what we call harmonization of the donor within the whole concept of the Declaration of Paris. These are all issues that we are concerned with in terms of the dominant model in cooperation and the alternatives to be found. The dominant model is of centrally made definition. The model is lack of harmony, lack of coordination among the donor agencies, and it is many times, or actually there's no alignment with the policy of the country. Aligning and harmonization are the two most important concepts that we should demand from global players when they dialogue with us through the International Relations Office in terms of cooperation. Cooperation delivered to the country, but many of our countries are donors. In terms of South-South cooperation, then the question to this International Relations Health Office, how do we do international cooperation? Are we just like the same of the donors that we are criticizing? Are we going to be aligned with the policy of the countries? Do we connect and we harmonize with other donors or even with other United Nations agencies or other private foundations or the agencies of of other countries, the same issue in terms of international cooperation that is in our countries as receiving end happens with us as donors. Who are the brokers? The international relation officers. International relation health offices are very important in terms of policy, in terms of political cooperation, and also in technical cooperation in those fields. The international relationship offices are of extreme importance. And in closing, I am going to just be recommending to you the participants of this process should shared of learning and education. Let's say the participants should read the text that modestly we provide, but it should not be restricted to the text that we modestly organized as just actually as a script. We are delivering also a set of other texts. The issue is extremely complex. The issue is very vast. Literature is enormous. Experiences that are reported also. Also, the concepts are wide, so we'll have to make an effort in order to learn about this whole field of global governance, since this global governance has powerful influences on health in our population and on the social protection systems in our health systems. So this presentation just made is an invitation extended to you so that you can read this literature. So each one of the participants should find their very own experience, should consider their very own experience in terms of the literature that we're providing you with, so that you can bring, when we are going to be face-to-face, your very own contributions that I try to summarize in this exercise that I proposed to the participants. If your participants could identify the United Nations agencies in your very own countries, and if you could identify how these agencies, that is not actually PAHO or WHO, but the other agencies, UNICEF, UNDP, whatever, which programs of cooperation in health they have installed in our countries. The second thing, how is it that philanthropic institutions, that big foundations, are present in our countries? What type of programs they have? With whom? We are going to be having, and we have to understand what these institutions do in the field of the public health in our countries, specifically in terms of the 2030 development agenda. I made a few comments, and I would like also to see when we are going to be together face-to-face to see what you think about this, what the participants think on one hand, also fed by our modest text and by the broad literature that also we are suggesting to be read, but especially by the experiences that each one of you have in terms of your international relations offices in your countries. Thank you very much.